Welcome, everyone, and thank you for joining our webinar today with Donna Hemaker and Thomas Nadig on the topic of teaching health law in a politically charged environment. Ms. Hemaker and Dr. Nadig are the authors of the new second edition of Healthcare Management and the Law, which just published in March. My name is Sophie Teague, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones & Bartlett Learning. And for those of you who are not familiar with Jones & Bartlett, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. So now let me introduce you to our featured presenters, Donna Hemaker and Thomas Nadig. Donna Hemaker is the Director of the National Institute of Healthcare Management and Law and a former adjunct professor of health law in the MBA program in biotechnology and health industry management at Penn State University. She's also the former president and CEO of Collegiate Healthcare Corporation. Ms. Hemaker holds a Master's of Governmental Administration from the University of Pennsylvania Wharton School of Business and a JD from Temple University School of Law. She was also a fellow at Hebrew University Faculty of Law and London School of Economics. Thomas Nadig is the hospice chaplain at the Hospital of the University of Pennsylvania Healthcare System and an adjunct professor of humanities at Widener University. He is a former board chairman of Collegiate Healthcare Corporation, and Dr. Nadig holds a Master's of Divinity from St. Mary's Seminary and University, a Master's from Notre Dame University, and an EDD from Widener University. He also held fellowships at Oxford University, MIT, and UC Berkeley. Ms. Hemaker and Dr. Nadig are the authors of two books from Jones & Bartlett Learning, Healthcare Ethics in the Law, first edition, which just published early in 2016, as well as the new second edition of Healthcare Management and the Law, which just published last month in March. So with that, I will now turn things over to Ms. Hemaker.
Thank you, Sophie. One of the things I would like to first address is when looking at the idea of fake information and healthcare reform. There was a quote at a recent conference by the Wharton Healthcare Business that encompasses what we're trying to address in this webinar, and that is, let me quote it, is that fake information has seemingly suddenly become fashionable. In reality, this fake has proliferated for over a decade or more, but the false, the flawed, and fraudulent are now pressing issues because of the changes that have come about as a result of the reforms in the U.S. healthcare system by the Affordable Care Act. And all this is occurring in a very politically charged environment that is breaking all boundaries. And we often hear that referred to as alternative facts. One of the things that we have seen is that most of the time we're going through the world without really paying attention. We ignore much of what is in the world that is around us. We see without actually seeing, and we're sleepwalkers in our own world. And we classify others as others, and we really don't see them as individuals. And we have a tendency to classify new ideas as crazy, and we really don't give them a second thought. And we have a tendency to trend the same old paths, and we don't look left or right. Now, the health law issues, given this, to focus on is one, how do we cultivate our ability and the ability of our students to see the law differently? Secondly, how do we remove our own blinders and the blinders of our students to come up with new perspectives? And third, how do we take these new perspectives seriously enough to transform the way everyone sees the U.S. healthcare system, but not so seriously that we lose touch with our past, or our traditions, or our current reality? when we look at this, it's really all in our heads. What we see and act upon is more of a product of what's inside our heads than what's out in the world. While not every thought we have can become a reality, the greatest obstacle to transforming U.S. healthcare, our society, our own personal lives, is our current thinking. This seems like very simple in theory, but it has far-reaching implications, and it affects how we approach healthcare reform and how we approach the world. The core issues to think about are, one, we are not just data-driven. The facts are the facts. We often think we're data-driven, that the world is how we see it, that the law is the law and there is no other. However, when we look at the brain as a computer versus a biological system, we realize that our brains change and evolve over time. Over 1 billion neurons are constantly dying and being recreated. Several trillion synapses are being destroyed and creating anew. The brain selects and reinforces or weakens certain synapses to forge the complex neural structures that determine our thinking. We reshape these neural models through our experience, our education, and our training. While the new neuroscience looks into how our brain works, we have to focus on what we need to do about it. Genetics provides a fundamental basis of who we are and what we can do. Experience shapes our genetic capability. It strengthens some and weakens others. We have to focus on the forces that nurture, shape, and reshape our mental models. Examples of this include our education, our training, the influence of others. One of the things I constantly say to students is choose the healthcare system that you're working in very carefully, because that will influence what you become. We also have to look at our own personal experiences, work as well as our personal lives. I'm saying we don't get into a cosmic debate about the real nature of the brain or the universe, but one of the issues we constantly have to say is, what does this mean? What does this neuroscience mean to us today as faculty members? What are the practical applications of this new neuroscience? There's great risk. At the same time, there's great possibilities out there. Knowing what we do about neuroscience, we have unprecedented opportunities to blend the best of the old and the new. It's risky to change all our old views of the healthcare system, yet the traditional views of healthcare, physicians, health insurance, our belief in science, they have all eroded. Now, some positive consequences, but chaos in the vacuum. If we can navigate our passage to new mindsets, we have the opportunity to discover new worlds with great potential. The internal models that we have are very difficult for us to recognize and change. We have to remember how amazing it is that our memory and perception can be much more than what we think. I was a neurologist of Walter Friedman from the University of California, discovered that the neural activity due to sensory stimuli disappears in the cortex. Now, we're not really seeing what we take in. Stimulation flows into the brain, and it appears to evoke in its place an internal pattern, which the brain uses to represent external situations. In other words, when we think we see the real world, what we're actually seeing is what's already in our own minds. And we accept what we think we see as reality, and we're not really aware of the power of these internal mental models. And this blind acceptance can be limiting, sometimes even dangerous. According to what standards or actions are lawful or unlawful, ethical or unethical, right or wrong. We become very comfortable and dependent upon our current mental models. What we do, we usually minimize or ignore. Why might that be? Changing these models opens us up to great uncertainty and risk. And most people are risk adverse. We tend to stay what we're comfortable with, and this causes increasing problems. We call this, it's often termed adaptive disconnects, also cognitive dissonance. And when we adapt our thinking at different rates, this is what we refer to in our textbooks as adaptive disconnects. It refers to the difference between liberals and conservatives, Republicans and Democrats, differences within organizations, between the views of different disciplines. We see this in marketing and operations, clinical care and management. We see it in higher ed, between the faculty and administration. We also see it as differences between being lawful and unlawful. What's ethical, unethical, right, wrong. So here's a chart showing 4 different steps that we need to understand. Number 1 is understand the power and the limits of these mental models. Again, we're referring back to the fact that what we actually see in life, it's based on the internal patterns in our mind. So we have to understand that mental model. And then secondly, test the relevance of those mental models against the changing environment. Constantly generate new models and develop a whole integrated portfolio of mental models. Third, we have to overcome the inhibitors to change by reshaping the infrastructure and the thinking of others. And fourth, if we transform our world by acting quickly upon the new mental models, continuously experiment and apply a process for assessing and strengthening those models. So it's constantly, as soon as we transform the world, we go back and we go through the whole process again and again. In summary, we say we need to wake up. We can reform the U.S. healthcare system. We understand that our mental models shape our world, and we have to keep a flexible portfolio of mental models to help make sense out of the world, and then constantly adapt and create new mental models as needed. Sophie?
Well, thank you, Ms. Hamaker. That was a fantastic presentation. And at this point, we're going to turn to questions, and I do have a few questions coming through here from some of our instructors who teach this course. Here's the first question. Do you anticipate any changes to the Affordable Care Act over the next few years of the Trump administration?
Well, I think the current political situation makes it probable that change will be made to the Affordable Care Act, although many ask why the government cannot simply get out of health care and allow the market forces to regulate the industry. The history of U.S. health care is the best explanation of why this doesn't work. The government did stay out of the individual market until it passed the Affordable Care Act in 2010 at a time when millions could not obtain health insurance and costs were skyrocketing at an unsustainable pace. And then in 2014, when the bulk of the act became effective, a market that previously did not exist was created, and that market is one that insured sick people. And it was a market failure that the health insurance industry historically would not cover those who desperately needed health insurance. And if everyone is to have access to affordable health insurance, the government must be involved. Otherwise, the millions of people who are left uncovered and unable to access affordable health insurance. An economic reality of having a vast number of uninsured with only limited access to health care is not desirable. So repealing the Affordable Care Act won't address the necessary role of government in health care. What I anticipate seeing happen is we're going to have a Rose Garden ceremony, and the supporters of the Affordable Care Act would maintain they kept the act, while the proponents of the Affordable Care Act will say they've improved the act. So in essence, I see some minor changes in the Affordable Care Act, but nothing that's significant. Changes are needed, and I think they will be made in the next few years.
Great, thank you. Here's another question. To what extent do your two books touch upon the rollout of the Affordable Care Act?
Well, both of our textbooks, one on healthcare ethics and the law, as well as one on healthcare management and the law, they're based on current issues facing the healthcare industry. And they deal with the law and after the bulk of the Affordable Care Act became effective in 2014. So both textbooks are based on how the Affordable Care Act has rolled out and the issues that the nation has confronted, not only in the legislation, but also that have ended up in the courts.
Okay, great. Thank you very much. We have another question here. What outside resources, such as journals, websites, et cetera, do you recommend reading in order for instructors to stay up to date on any changes related to healthcare reform or health law?
We have developed ancillaries to both of our textbooks that list by subject matter and by issue. For instance, women's reproductive issues, gun control. We list most of the current peer-reviewed journals as well as websites that address each of these issues. In addition to those outside resources that are listed in the student ancillaries and the instructor ancillaries, there's an ongoing blog that updates court cases as they are decided.
Fantastic, thank you. How about classroom and homework assignments? Can you recommend any classroom or homework assignments for students to ensure they become savvy and critical consumers of news and information related to healthcare law?
Yes. Also in our ancillaries to both of the textbooks, we list classroom and homework assignments. This is based on our years in the classroom, as well as the consulting that we both do.
Fantastic. And let's see, we have one last question here about the rollout of the ACA and other healthcare laws. How do you see the rollout of the ACA, MACRA, and other healthcare laws impacting healthcare administrators in the short term as well as in the long term?
I think we're going to see, like, many avenues for change under the Affordable Care Act. We're beginning to see that in discussions that are occurring in the Senate at the current time. I think we could see revisions for small businesses, maternity coverage requirements, how the tax exemptions are being granted to healthcare entities in return for literal no community benefits. This is an issue that we address extensively in both textbooks, how our current tax-exempt healthcare systems are not really having any accountability to the communities. We'd also, with these concentrated changes, proponents of the Health Care Act, as I mentioned in the first question, could say they have rescued the law under very tough circumstances, while opponents can maintain that they rehabbed the law with a plan that we're retaining the best while improving for the long term. One of the big problems we have is with health insurers opting out of the marketplace, and that leaves us fewer choices for people trying to purchase policies through the health insurance exchanges. And if we follow the laws of supply and demand, fewer choices are translating into higher insurance and premium. And we see many insurers leaving the exchanges because forecasting regarding the subsidies to the industry, as well as taxpayer assistance with the premiums, it was faulty. And many insurers are not seeing the revenue they expected from participating in exchanges. And whether the insurers continue to participate really depends on the math. And the more uncertainty there is with what happens in Washington, the more likely insurers are going to opt out.
Okay, great. Well, thank you so much, Ms. Hemaker. That about wraps up, or that does wrap up all the questions. At this point, I'd like to speak for a moment about your new book, Healthcare Management and the Law, second edition. This is a comprehensive text designed for those who will be leading and shaping 21st century healthcare organizations. And the book raises questions about health law issues such as the emergence of the U.S. as a player in the global healthcare industry, innovative new approaches to the payer-provider model, and the future of tailored therapeutics. And throughout the text, you've done a fantastic job of addressing the challenges of what many view as a healthcare crisis in the United States, examining how laws must be reformed to create a system that works properly. And it's truly a unique book in that it bridges research and practice, reflecting new real-world knowledge of the healthcare industry and government agencies. The concepts are practical, and it provides current and future healthcare managers with sufficient knowledge of the law to become intelligent, critical thinkers in professional practice. Challenging current administrative and judicial decisions are presented, and students can customize their learning experiences by selecting from 37 chapter topics or studying specific topics in depth using the text bibliography, as well as the multiple resources provided. What I think is so great about this book is that you focus on interpretation, insight, and ideas. In other words, the meaning of the law, not only what occurred pursuant to it. Some of the key features are that it explores not only physicians and hospitals, government regulations, and medical insurance issues, but it also looks at the producers of medical products, such as pharmaceuticals, biotechnology, and biopharmaceuticals, medical devices, and health information technology. It also includes comprehensive, unbiased case studies presented in a way that reflects the function and intention of the court's ruling, and it's written with state-of-the-art research methods using searchable online databases that are revolutionizing research on healthcare management and the law. It also reviews jurisprudence and seeks common themes as well as conflicts, and it clearly explains the innovations transforming global health industry practices and public policy. Any instructor who would like to consider the text for course use, I invite you to go to our website. You can follow this link, go.jblearning.com/HamakerL. And from there, you can request a complimentary review copy. You can download sample chapters, and you can also request access to instructor materials. The book is accompanied by a companion website, so your students will get an access code card that will get them entry into a companion website that offers additional learning resources, including an interactive glossary. So all that is available on our website at jblearning.com. With that, I would like to thank everyone for participating. If you have any further questions, please don't hesitate to reach out to me at steag@jblearning.com. I'm happy to answer questions, for example, about how to get a copy of the book or anything else, or if you have further questions, I'm happy to forward them along to Donna Hamaker. And the full recorded webinar will be posted on our new LinkedIn Public Health Faculty Lounge group, and that's at go.jblearning.com/PHLinkedIn. Thank you very much, Ms. Hamaker, for your presentation today.
Thank you, Sophie.
And thank you from Tom.
Thank you, Dr. Nadig, very much. And thank you again, everyone, for participating, and that wraps things up. Thank you.